What's up, everybody? This is Coach Nathan Barbosa with PhysioFix Training Systems, and in this video we're going to be working on hip flexion at the in range of the motion. This is going to be a linear drill. We're going to be working on encouraging the hip flexor to work as well as possible at its highest point, as well as getting the tissue on the opposite side to activate and work with us at that point as well. So you're going to be feeling some hip and some hamstring in this video, but primarily we're working on opening the hip and flexion, or bringing the knee up. So how we're going to do this, we need a platform or a table. I've got the massage table here, so this is what we're going to use. Ideally, you want the platform to be about as high as you can bring your foot up. So for me, the table is about as high as I can bring it up, so this is going to work pretty well for me. If this is the first time you've ever done any type of drill like this, I recommend you use a platform that is probably about 2 or 3 inches lower, just so you can give your body a chance to figure this out. And if there is any pinches or pains that go along with it, you can figure those out. You can reach out to me, and then we can talk about why, and I can give you exactly what you need to know so you can fix your stuff properly. So we're going to bring our foot up, put it up on top of the table, and from here we're going to tilt the hips forward as if we're going to try to spill them forward. So hands on the hip bones, tailbone goes back, and feel like you're just kind of rolling it forward. As you do this, if you're really tight in here and then you go to tilt your pelvis back, you'll feel a stretch very high in the hamstring where it ties into the glute. Way down in here, it almost feel like you might be confused if it's groin or if it's butt or if it's hamstring. If that's the case, then you're probably in the right spot. So again, we want to close the gap in the knee, so we don't want to be all the way out here. We want to be here. From here, we're going to push the tailbone back behind us, dumping the hips forward, and this is going to be our passive stretch position. We're going to sit in this position for about 2 minutes, 2 full minutes. While we're here, we're going to take deep breathing, parasympathetic breathing, 4 seconds in, and about 6 to 8 seconds out. This is all through the nose, all nose breathing to try to relax the body and relax this tissue. After the 2 minutes, the first thing we're going to do is our pales contraction, which is the progressive angle, which is going to be the stretch side. So that's going to be activating all this stuff back in here on the bottom side of the leg. So how we're going to activate this is very simple. We're just going to make sure we have that tilt and we haven't lost it, and then we're going to slowly and easily start pushing the leg and the foot down into the table. You're going to start this at about 5-10% effort, and over the course of 30 seconds you're going to ramp up to your safest, greatest effort until you feel like you're trying to stomp through the table, and then from there you're going to try to pick the leg up. And this one's tricky. You don't want to fall back as you go to lift up. You want to stay forward. And then with this, I would either put your hands across your chest or maybe to the side, and we're just going to play like we're going to try to lift, leg up. As you can see, nothing happens, which is what we want. We want you to be at that end range of motion. This is not a lift off. This is an isometric. So we're going to try to stay in this end position. Hips are still tilted, and we're going to try to pull it up. We're squeezing the tissue on top of this thigh as if we're trying to pull the knee up. We're going to hold this for about 15 to 30 seconds. And then we'll just relax. We'll get deeper into the stretch. We'll tilt the hips again. And then we're going to sit here for another 2 minutes. So the biggest thing about this stretch, or this drill, is when we go to pick up the knee. If you try to really pick this knee up super hard and there's a whole bunch of pain in the hip, then you're not going to pick the knee up. There's no lift off at all for you. This is just a step down. If you want to try to work into it, this is totally up to you. You can give this a light lift and kind of flirt with that pressure in the hip, and then just relax, go back into the stretch, and then do it again. See if that closing angle pressure or pain goes away. If it does, that's a sign that there's nothing super major going on. If it doesn't go away, that's a sign there is something that's going on. It might not be major, but there's something going on. And that's where you want to reach out to a tissue therapist, a chiropractor, massage therapist, or just another FRC or mobility guy, and see what they have to say about it, and then go from there. That's something that I can help you with, or you can check the practitioners page. You can go through the list and see if you can find an FR practitioner in the area who can help you release that tissue and actually get it out of the way. That way when you do this type of stuff, you're not in pain. So, quick recap. The stretch, foot on the box, lean in, hips go back and spill forward, creating the stretch in the back of the leg. Hold for 2 minutes. Ramping pressure going down, starting at 10% effort, ramping up to your safest, greatest effort, and within 30 seconds. I want you struggling and trying real hard on that push down. From there, if there's no pain in the front of the hip, then you can try the lift off, and imagine you're going to try to pick the leg up even though it's not going to move to activate the stuff on top. Then you go back into the stretch. I recommend doing this for 2 to 3 rounds. If it's your first time doing it, maybe just try it once or twice, see how it goes. And again, this is Nathan with PhysioFix Training Systems. If you guys need anything or have any questions, please let me know in the comments. Thanks for watching. You guys have a good one.